recognize the gentlelady from Arizona, Ms. Lesko, for her 5 minutes of questioning.
Thank you, Mr. Chair. My first question is for Mr. Tabak. You told Congressman Carter that NIH did not fund EPPP research in foreign countries except for an influenza experiment in the Netherlands. Was that experiment funded by a direct grant or a subgrant?
The experiment in the Netherlands, I believe, was a sub-award, but I would have to check to confirm that. And that was done in I think it was in the early 2000s. It's been a while.
Okay, and how then did the NIH know about the experiment as a subgrant?
It was approved under the then DIRC/P3CO framework, and we used the normal monitoring procedures for that, yes.
In the case of EcoHealth in the Wuhan lab, the NIH was unable to get the records of a humanized mice experiment because the Wuhan lab, the subgrantee, refused to provide this to EcoHealth. Given the failure of an NIH grantee to get lab records, there could be other cases where NIH can't get the lab records. Isn't that right?
It's possible. As you know, that sub-award has now been terminated. They are no longer funded by NIH to do anything.
So how can you state, how can the NIH know for sure that it hasn't funded EPPP when NIH can't be sure it can get the lab records of experiments funded by NIH?
As a result of them failing to provide us with the adequate documentation, they no longer have any funding from NIH. The NIH funding, we approve what they are to do from their progress reports and from their publications. They have done what they said they would do. The work was commensurate with the modest sums of money that we provided to them. I don't know what other work they're conducting there.
I guess what I'm saying is that if we couldn't get the reports accurately, how can you definitively say that there was no funding of this? And so anyway, I have another question for you. As the Vice Chair of the Oversight and Investigation Subcommittee and a member of the Select Committee on the Coronavirus Pandemic, I can't stress how inexplicable the failure, I believe, of NIH oversight on the EcoHealth Alliance grant is to me. In 2019, EcoHealth Alliance failed to submit a required annual report on the research it was conducting related to the emergency of the bat coronavirus. The 2019 progress report was due by September 2019. The COVID-19 pandemic began late 2019. Despite a bat coronavirus pandemic emerging in the city where NIH-funded bat coronavirus research was taking place, NIH failed to even ask for the missing progress report until 2021, and it was still not actually submitted until months later, more than 2 years after the due date. Given these circumstances, how did the agency fail to notice that the annual report on research done by EcoHealth and the WIV was overdue for 2 years?
The most important point to appreciate here is that the viruses that were under study in that sub-project bear no relationship to SARS-CoV-2. They are genetically distinct. They are absolutely unrelated to SARS-CoV-2. That's the most important thing to understand. As far as the administrative
And how do you know
oversight,
that for sure, sir?
by looking at the phylogeny by looking at the genetic sequence. It would be equivalent to saying that a human is equivalent to a cow. That's how distant the sequences of the bat viruses that they were using in this work were to the actual SARS-CoV-2. Now, the administrative overlap, the administrative issues, we concur with that. We concurred with the oversight report. We have taken steps to redress those administrative issues.
Thank you. I have only 13 seconds left, so I will yield back.